Hi there, I'm Scott McKenzie, founder of home care agency Blueprint, and if you've been thinking about starting a home care agency in Oklahoma, this video could save you months of confusion and thousands of dollars in avoidable mistakes. Because what most people don't realize is the way home care licensing works in Oklahoma is completely different from how it works in many other states. And if you don't understand those differences up front, you can end up spinning your wheels. Let me walk you through it clearly, step by step, so you know exactly what's required to launch a non-medical home care agency here in Oklahoma. Let's start with the core services. When we say non-medical home care, we're talking about services like companionship, bathing, grooming, light housekeeping, laundry, errands, transportation, meal prep, medication reminders, what we call personal care or companion care. This is not the same as home health, which involves skilled nursing or therapy services. I'll touch briefly on that later. Now, here's where it gets interesting. In Oklahoma, if you are only serving private pay clients with non-skilled services, the state does not require a formal license. That's right, you don't have to go through the full Department of Health home care licensing process the way you would in states like California, New York, or Texas. But that doesn't mean you're off the hook. You still need to build your agency correctly from the ground up, because you're running a business that's serving vulnerable people in their homes. Now, if you do plan to accept Medicaid in Oklahoma, that's a different story. You'll need to become an Oklahoma Medicaid personal care provider, and the agency that handles that is OHCA, which stands for Oklahoma Health Care Authority. Their application process involves several steps, including fingerprint background checks, uploading your policies and procedures, and going through a provider enrollment process that can take a few months. It's doable, but you want to be well prepared before you apply. Let's talk about costs. Forming an LLC with the Oklahoma Secretary of State costs about $100, and renewal each year is typically $25. You'll also need an EIN from the IRS, which is free, and it's smart to register your business name with the state if it's different from your legal entity name. Now your next expense is insurance. Even if you're not licensed, you absolutely need general liability insurance. And if you're hiring employees instead of contractors, which I recommend, you'll also need workers' compensation insurance. On average, general liability runs between $500 and $1,000 per year, and workers' comp depends on your payroll. And here's a major one people overlook: policies and procedures. Just because the state isn't requiring a full license doesn't mean you can skip this. You need airtight documentation for your client intake process, caregiver training and supervision, emergency protocols, HIPAA compliance, abuse and neglect prevention, caregiver discipline procedures, and more. When you start hiring caregivers, you'll also need things like employment agreements, codes of conduct, orientation checklists, and your employee handbook dialed in. All of this not only protects you legally, it also helps you grow faster because you're building on a real foundation instead of winging it. Next up, timeline. If you're starting a private pay agency, you could technically launch in 30 to 60 days if you're efficient and get help with setup. That includes forming your business, getting insured, setting up your policies, building a basic brand, and onboarding your first caregivers. If you're applying for Medicaid provider enrollment, plan for a timeline closer to 3 to 6 months. That includes preparing your full provider packet, undergoing any required training, and completing the OHCA approval process. You'll also need to connect to the Medicaid billing portal and meet all compliance standards. Let's talk briefly about naming your agency. Oklahoma doesn't have strict name restrictions like some other states, but I always caution against using words like medical or home health in your business name if you're only offering non-medical services. Stick with clear, simple names that communicate warmth, care, and trust. Think companions, care, support, or something personal to your mission. Now, what about caregiver training? Here's where a lot of people get tripped up. Oklahoma doesn't require your caregivers to be CNAs if they're doing non-medical work. But that doesn't mean you should throw someone into a client's home without preparation. At a minimum, I recommend providing 8 to 16 hours of training in infection control, safe lifting and transfers, personal care techniques, communication with seniors, and emergency response. You should also train them on client rights, boundaries, and how to report red flags. Trust me, investing in caregiver training early will save you from major liability down the road and improve your client retention. Now let me briefly explain the difference if you're looking into skilled home health. If you want to offer nursing services, wound care, IV therapy, or physical therapy in the home, that's considered skilled care. For that, you'll need a full home health agency license through the Oklahoma State Department of Health. That process is longer, more expensive, and involves Medicare certification if you're billing federally. So if you're just getting started, stick with non-medical private pay. It's easier to launch, lower liability, and still extremely profitable if you do it right. Now here's where I want to give you some rare insights most coaches don't mention. First, build your brand before you build your website. Your logo, your name, your tagline, it all needs to reflect who you are and who you serve. Don't slap together generic colors and a stock photo. Your brand should feel trustworthy, warm, and local. Second, start building referral relationships before you're ready. Talk to senior centers, rehab facilities, church groups, and elder law attorneys now. Let them know you're launching a new agency and want to be a resource. That's how trust begins. Third, shadow your first caregivers. I tell every client, ride along for the first few visits, not to micromanage, but to understand what your caregivers experience. You'll learn more in 3 hours than you will in a 3-day training course. And finally, go digital from day one. Set up a care management system, payroll software, call tracking, and digital timesheets. Don't wait until you're overwhelmed. The best agencies run lean and automated, even with just a few clients. If you're still with me, chances are you're serious about starting your agency the right way. So here's your next step. Book a free clarity call with my team. It's 15 minutes, no pressure, and we'll walk you through what's needed for your situation. Whether you're going private pay or Medicaid, solo or with a team, you'll walk away with clarity and a game plan. Just click the link in the description to schedule your call now. I'm Scott McKenzie. I believe in this industry. I believe in doing it with heart, with excellence, and with intention. And if you're ready to step into this space, let's do it together. Looking forward to connecting.